I love your philosophy of minimally invasive and love that philosophy. Talk a little bit more about your philosophy as a pediatric dentist.
It depends really on the age range. Um, the initial goal is to have fun, short visits so children know what it's like to see a different type of provider that doesn't necessarily give them vaccinations. Um,
So
it
I've been asked this question. Let me ask you this question. Um, if a parent was asking you, when's the right time to bring my child in for a first visit, what would your answer be to that?
it's 6 months after the eruption of the first tooth and no later than the first birthday per the American Academy of Pediatric Dentistry.
Awesome. And talk to our listeners about. I'm a big believer in starting, a child off with a great first visit, because if we do that, it's sort of setting the framework up for a lifetime of positive experiences at the dentist. And if we can start them off with a great first visit, it's a great first step. Um, how do you do that to try to make that first visit as positive as possible? How do you do that?
Although we are a pediatric practice, we cater to the modern child, the sophisticated New York, Brooklyn patient. So we are not a childish practice. We use a lot of technology. We utilize the parents a lot in developing that first good experience. Um, the exam itself can be quite short because the patient may only have a couple of teeth, but it's really informing the parent because the parent is the person that's typically with the patient more than me. I may see them twice a year if I'm lucky. So it's really educating the parent so that they can be a great team member when I'm not around. So really focusing on nutritional counseling, oral hygiene, how much fluoride is optimal for the patient with a number of teeth that they have, and establishing good habits. That's really important. And also kind of being mindful that this little human being doesn't have the manual dexterity or the fine motor function to be able to do a lot of the things that the parent expects
Yeah.
them to do. So really getting in there and helping their babies out.
Well, you anticipated my question as happy you did. You anticipated my next question, which is, do you like the parent in the room or not in the room? And you anticipated that, and I love your answer for that because, hey, that makes a lot of sense, doesn't it? Um, the parent's going to be the one that'll have the dominant influence there, and you're training the parent as well as treating the child.
Absolutely.
Yeah, love that treatment philosophy for sure.